What are the symptoms of gum disease?
There are several things that can indicate gum disease, but one of the things typically is bleeding gums. However, sometimes looseness of teeth, and oftentimes you may even find other systemic issues that may trigger and may be traced back to periodontitis.
Even sometimes fatigue.
Correct.
Dr. Schwartz, what are the stages of periodontal disease?
You can think of it in three ways. We have the most superficial form, which is gingivitis. People think they can use mouth rinse and cure it. It's basically a generalized irritation of the gums, and it's not associated with any bone loss or attachment loss. The second phase involves a mild to moderate loss of bone, and the tissue becomes more inflamed. We don't usually see mobility of teeth, so it's very asymptomatic. The advanced stage, which is advanced gum disease or advanced periodontitis, oftentimes the bone loss can be so severe you develop gum abscesses, sometimes called pyorrhea, and you may notice pus, a lot of bleeding, and in the worst cases, the teeth actually begin to move.
A lot of patients ask me which is the best mouthwash to use to treat gum disease, and what is your answer?
Well, the answer is gum disease won't really be treated effectively by mouth rinse because it's superficial. As the disease process advances, bacteria and other pathogens get deeper into the tissue, and you need something a bit more aggressive, usually mechanical cleaning or surgery.
So there is no mouthwash that will really treat advanced gum disease?
No, there is no treatment, at least not properly.
So we know that mouthwash doesn't treat advanced gum disease. Patients ask me about a mouth rinse called chlorhexidine. Could you go into that?
Chlorhexidine is a very strong chemical. It's very good for washing out wounds and things like that, and that's what it's designed for prepping people for surgery. However, gum disease and any infection in the mouth actually can be negatively affected because it's such a strong chemical, it actually slows down healing. So if we do any kind of surgery or treatment, it can actually prevent the tissue from recovering.
Right. And it also stains the teeth.
It stains the teeth and also alters taste.
Yeah. Chlorhexidine is definitely not the right solution to treat advanced gum disease. You need a specialist to treat that, correct?
Correct.
Another question that patients ask me is gum disease contagious?
Gum disease is not contagious. Now, there is a hereditary factor, but it's basically a buildup of bacteria in your own mouth over time. It is not somebody else's.
Right.
Gum disease has two causes. One is your own body's immune system, a response to bacteria, and that's the second stage. Bacteria builds up on the root surfaces, and it can go into the tissues. And essentially, it becomes like a foreign body, a splinter, and that causes loss of bone and deterioration of attaching tissues. If you think you have gum disease, here are some things that you may look for. Oftentimes, bad breath, that won't go away. Other things you may consider, if your teeth are elongating or gums are receding, you may notice your gums bleeding. Two tools that we use to evaluate gum disease are through x-rays to see if bone loss has occurred. We also use an instrument called a probe to measure the depth of the gums. Once we've addressed gum disease and any treatment necessary, maintenance is a very important factor. We usually recommend cleanings every 3 months. At home, two important factors: brushing, and especially brushing along the gum line, and obviously flossing at least once a day is very important.
One of the things we see in the office is people who smoke and how smoking just decimates the mouth. Could you go into that?
Well, if you think about it, the chemicals in smoke, benzene, carbon monoxide, are absorbed into the tissues, and they just start to destroy the cells, as you say, decimate. They slow them down. In some cases, they kill them, and the cells cannot respond normally. The immune response is depressed, and that can lead to many things, including gum disease.
In addition, a nicotine patch still affects the mouth.
Nicotine.
If they want to get off smoking and they want to use a nicotine patch, it's still, it's better than smoking, but not much.
Correct. Well, nicotine is a very potent chemical, and it has several side effects, and part of that is the response of cells.
Right. Well, I have patients coming in and say, "Doctor, I've got great news. I quit smoking, and now I vape." Dr. Schwartz, what's your opinion on that?
There's no difference.
So what we see clinically is no difference between
No
smoking
difference.
and vaping.
Terpenes, formaldehyde are very toxic. They get absorbed and they have very similar effects to nicotine.
And what's scaring me is I'm seeing the youth do vaping more. A very susceptible group is now vaping, thinking there's no harm to vaping, and there's serious effects, not only systemically but in your mouth.
Correct, because there isn't necessarily combustion as there would be in cigarettes as opposed to vaporization. There are still aerosolization of chemicals, and you're absorbing those chemicals.
So bottom line, don't vape, don't smoke.